So reflexology has multiple ways that we look into the body. Pulse is not normally one of them. Pulse is reserved for other systems, other holistic practices, and I really want to be a little bit more vocal about pulse work in reflexology from a practice perspective, because I think it is a very important tool. I think it's a very interesting tool, and I think it's something that a lot of practitioners don't have exposure to, and I'd like to, if I may, expose you to the wonderful world of pulse. And I think that, especially because we can access the pulse through the feet, and I'll go over how I do that in my practice. And please feel free to ask questions and comments as everybody starts to log on. But I personally have viewed the pulse as a tremendous asset and an additional layer of seeing the body through the lens of another kind of quote-unquote extremity, although the pulse isn't necessarily similar anatomically to the hands, feet, face, and ears. We can still use the pulse and the different layers of the pulse to assess somebody's physical constitution and their mental emotional state, which is really what I find fascinating, is not just doing the hands-on manual reflexology work, but also taking the time to look into the body, because that's really what reflexologists do, is we look at the small part and we see the bigger whole. Okay, so let's go through some of our stuff, shall we? Okay, so what exactly is pulse assessment? So we're applying reflexology principles first and foremost. We're still allowing our practice to say this smaller part represents that bigger whole. We're taking what would be a pulse point, something that we would normally use to check blood pressure, and we're actually allowing that part to become the map of the body for us to then use those different parts of the pulse to gain insight into three major sections in this case, which give us a massive amount of insight into somebody's physical constitution and mental emotional state. And one of the things that I really like to drive home to students is making sure that they understand that we're not really introducing a new topic. Although pulse is new for a lot of people, the principles are the same. The body follows anatomical position, the pulse follows anatomical position, and we're using the exact same map. We're just dividing it a little bit differently and looking at a different surface. And it's the same thing that when clients ask me, well, why would I get my face work done or my ears work done or my hands work done as opposed to the feet? And my big response to that is it's really a very case-by-case a case-by-case situation. There's no right or wrong way, and they all give us the exact same amount of information. It's just when somebody comes forward with, like, let's say, TMJ issues or carpal tunnel, we would then go to that particular extremity. And the pulse is another way that we can use those same reflexology principles, use that same map, and we can start to unwind the layers of interconnectedness throughout the body system. So we're really confirming the maps that we're already using. It's not going to be a new map. It's going to be the old map, just divided a little bit differently. So as long as you know your zones, as long as you know your anatomical position, pulse work is actually exceedingly simple. It's just about practice. And we really need to reinforce that concept of thinking outside the feet. And when I started my practice, I was Massage Redefined LLC was the name of my company, and I integrated reflexology to the point where it was a majority of my practice. And eventually, my clients started calling me the foot whisperer, because when I worked on feet and I was able to tell what was happening in the body through the feet and what was happening, clients still come to see me just for the feet. But because I teach foot, face, hand, and ear reflexology, there's a lot of opportunity where, especially because I work by an Air Force base, and sometimes clients come in without a particular extremity. But then also, if somebody has pain in another extremity or one extremity has become compromised, it becomes a necessity to really think outside of the feet. And although reflexology has a popular base in footwork, and some people would think of reflexology as kind of like a glorified foot massage, and those of us who practice know that that's not necessarily an accurate description, but it is fair, because foot reflexology is the most popular form of reflexology. Pulse work can also give us the same insights or confirm the insights that we're already receiving through the other extremities. And that's really what I want to drive home is, regardless of if you're a new reflexologist starting out or you're just interested in reflexology or you've been practicing for a really long time, where reflexology is going is asking us to think outside of the feet, to think that the feet are the end-all be-all of the reflex craft, I think is an outdated perspective, and we really need to be looking at how this universal concept of the entire whole of the body represented by the smaller part is a theme that can be carried out throughout different expressions of the practice. Everybody with me so far? Make sure to drop a comment in the chat box and let me know what you are thinking thus far. And I look forward to answering questions as we go. Okay, so let's talk about methods of pulse assessment. And I think that this is something that a lot of us are familiar with, especially if you've been in the holistic health community for a while. Some of you are familiar with the idea of traditional Chinese medicine taking the pulse specifically. And traditional Chinese medicine uses the radial pulse or the wrist pulse in order to access the different meridians, the different channels, and again, give a zoomed in view of the bigger picture. Ayurveda is also famous for their pulse work, and they have a similar yet very different system to how they use the pulses. But again, their pulse work is traditionally radial pulse, the wrist pulse, not necessarily the foot pulse, although we will be focusing on the foot pulse today because as reflexologists, that's what we have most easy access to. Unless you are practicing hand reflexology and you'd like to start with the radial pulse, the principles are also very similar. Then there's modern pulse assessment, and for any of you who have been to a doctor, you've probably gotten your pulse taken, although I went to a doctor recently, and just for a checkup, and they slid the blood pressure cuff on and they just pressed a button on a machine and it took my pulse. And I asked the person taking my vitals, I said, when was the last time that you actually took a manual blood pressure with a cuff and a stethoscope? And they were like, no, we don't do that anymore. I'm like, oh wow, that's interesting. So although modern pulse assessment when it comes to blood pressure is advancing and it's not necessarily a manual craft anymore, it's still a modern way that we use the pulse to assess somebody's state of being. And we'll talk about 120/80 and that kind of stuff. To really capture the idea of modern pulse and taking somebody's blood pressure as also an important part of a reflexology practice that involves pulse. Yeah. But we're really going to be focusing on a simpler approach. Although traditional Chinese medicine is wonderful, traditional Chinese medicine tends to get very complicated very fast when it comes to pulse assessment, and a lot of their practitioners will study very, very specific pulse assessment techniques, and they will make that the standard only diagnostic practice in their toolkit, and they take their entire lifetime to master this one aspect of pulse assessment. So I think that although pulse assessment that I'm going to show you is much simpler, we need to respect that this is just scratching the surface of a very, very deep lineage of looking at the pulse. Same thing with Ayurvedic. Ayurvedic can also get very complicated, especially when you look at doshic systems, when you look at the dhatus, the tissues of the body, and you start to pair all of those layers of information on top of pulse. Not to mention that it's not just superficial pulse that we're looking at. There are also deepening layers to the pulse, which we won't get into, but there's a lot of pulse information out there, and this is very much a simplified, watered-down version for reflexologists in order to expose you to the idea that taking a dorsal pedal pulse before and after the session can be a valuable intake tool in addition to looking at the reflexes and palpating as you go. Okay, so let's talk about the dorsal pedal pulse, shall we? So just for those of you who need a little bit of an anatomy refresher, dorsal is the top of the foot. Think of the dorsal fin of a dolphin. Yeah, it's the top of the foot. So the dorsal pedal, meaning foot, pulse. That's really what we're talking about here, is the pulse on the top of the foot. Now, as I was looking for pictures to show you where the dorsal pedal pulse is, I found this photo of this couple who obviously went on vacation and got a sandal tan, which I'm from Florida, y'all, and we get a lot of these tourists who have this very distinct marker on the tops of their feet, indicating that they were wearing shoes out in the hot sun. They probably got burned and then it faded into a tan. However, where they got burned is exactly where the dorsal pedal pulse is. So I thought that was really interesting. So for those of you who don't know the anatomical origins of the dorsal pedal pulse is between it's just medial to the second and first metatarsal heads. So in between the first and second proximal metatarsal heads, right where I've got that red circle, that's where we're going to find the dorsal pedal pulse. So as opposed to let's see, when we look at the zones of reflexology, the dorsal pedal pulse is actually between two zones. It's between the diaphragm guideline and the waistline guideline. It's just above the waistline guideline on the dorsal surface. So we're going to be palpating for the proximal head of the first metatarsal, and we're going to be going in between that first and second proximal head in order to palpate the dorsal pedal pulse on the top of the foot. However, if you want a simplified version, it's just not as accurate. It's going to be in between the first and second toe, halfway down at the top of the foot. But I'd really like to integrate my second point here about shifting pulses. So this is about where the dorsal pedal pulse is. And if you wanted to just Google the dorsal pedal pulse, you'll be able to see a little bit of a more specific anatomical description of this line, this pulse line that goes through the top of the foot. But every foot is also different. Yeah, some people have the pulse a little bit more medial. Some people have the pulse a little bit more lateral. Some people have a pulse that can't be felt over that proximal head, that dorsal bone bump, as some of you know, the anemia bump, which I've referenced in other videos. So we need to really make sure that we're choking up on the pulse in some cases, going a little bit medial, a little bit lateral. But in general, we're palpating that pulse in between the proximal heads of the first and second metatarsals. So it's going to be just medial technically to that proximal head, but in some people it'll be more lateral, some people it'll be more medial. It just depends on the foot that you have in front of you. So I'd really look at that red circle, see about halfway down on the top in between the first and second toe, right as you find that proximal head of the first metatarsal. Palpate that space and see if you can find it. And it does take a little bit of practice, unfortunately. This isn't just an easy thing, just like reflexology isn't necessarily an easy thing. We make it look easy, but finding the pulse, just like anybody else, any other technique rather, it's going to need a little bit of practice and time for you to get used to it. And what I mean by choking up on the pulse is actually going towards the dorsal ankle. Yeah, definitely. Yep. Seeing the questions rolling in just a little bit. So when we look at the dorsal ankle, the actual pulse that we're feeling starts there, and then it progresses through that most superficial spot before it dives deep again in towards the toes. And so we're catching that dorsal pedal pulse halfway through the foot. But if for some reason you can't find it or the pulse is super deep, you can always go towards the dorsal ankle and follow that line, follow that blood flow towards its source to get a stronger pulse variant, which you can then use to assess pulse just as well. Okay, so that's about the location, and we're going to get a little bit more specific with that. I love this picture. I'm so glad that I found this picture. So let's talk about the 3 pulse sections, and let's talk about what each of them mean. So again, what you can see on this slide with the x-rayed view of the foot is that we're right in between first and second proximal metatarsal heads. Again, it might be a little bit more medial, a little bit more lateral, but we're looking for that that red circle, that about area, to really show us what we're looking at right in through there. And that red line represents the pulse line. However, when we look at, oh, that's a good question. So somebody just asked in the chat, shouldn't we be using gloves on the feet now, especially for those of you who are watching the recording of this video. Right now, we're kind of in the heat of the coronavirus scare. I personally will never use gloves with clients unless I feel like something is infectious or a danger to me personally. I don't use gloves in my practice. It's not something that I personally feel comfortable with because it puts a barrier between myself and the client. Some of you who have an immunocompromised state or have immunocompromised clients, you might prefer that. And I've certainly had clients ask if I would prefer that as a practitioner. However, it's just not my practice to do that. I would rather tell somebody to stay home than to come in and receive kind of a half touch. Yeah, does that make sense? But when we look at the 3 pulse sections, this is really what we're focused on. So we have the distal pulse, the middle pulse, and the proximal pulse all together. So we have the proximal pulse first, and this is going to represent our lower body reflexes, or horizontal zone 4 and 5 together. In Ayurvedic terminology, this would be the Kaphic pulse, yeah, or the lower body pulse. In traditional Chinese medicine, this would be thought of as the lower jiao, or that lower deep pelvic core, that sacral and root chakra area. That's really what we're focused on now. Is this the pedal pulse on liver 3 acupuncture meridian location? I'm not sure, Pat. I don't know my meridians as well as that, unless I'm looking at my chart. So unfortunately, you'd have to Google that one. But this is the traditional dorsal pedal pulse that is on pretty much everybody. But again, this is what I talked about earlier. The pulse can shift. It can go medial or lateral, just like the meridians can technically shift. So we just need to be aware of, I'm giving you a general location, but it may not necessarily be in that specific location. It'll be close to it, but you may need to search for it a little bit. So we start with that proximal pulse, and it's proximal because anything that's proximal is going to be closer to the body, or closer to that midline of the body. And so that proximal pulse represents all of our lower body reflexes. That includes the legs, that includes the sciatic nerve, that includes everything in zone 4, so hips, reproductive, lower urinary, all of our pelvic muscles. It's a very important pulse. And one of the things that I really like about this 3 pulse method is that it really gives us a general overview of what's happening in the lower body. This pulse should feel slightly deep. It should feel slightly powerful. It should be slower. It should be a little bit heavier and thicker, just like the lower body, because the lower body has most of our muscle mass, most of our physical weight. When we think of energetics, it's that fog that sits on the field in the early morning. That is the energetics of the lower body. It is dense, it is moist, it is heavy, and that's what we're feeling through that proximal pulse. And what's interesting is people who have sciatic issues will have a very rapid proximal pulse. And so what we're going to be doing is we're going to be placing 3 fingers on those 3 pulse sections, and we're going to be palpating for that proximal pulse with our ring finger, our 4th finger, and that will give us an idea of what that lower body reflex location is trying to tell us from a palpatory perspective. Then we have the middle pulse, which is just going to be zone 3. It's just going to be upper digestive, and that's the M right there. So it's going to be the part of the pulse that's closest to where that navicular bone meets the proximal head of the first metatarsal, and that space really talks to us about upper digestive. Now, when we look at right side versus left side, we know as reflexologists that the reflexes are different from right to left. So we need to be aware that liver, gallbladder, as well as half of kidney and tail end of pancreas is going to be on the right foot, or the right pedal pulse, dorsal pedal pulse. and the left side, the left dorsal pedal pulse, will contain stomach, spleen, and a majority of pancreas, as well as upper half of kidney, both sides containing adrenals. Zone 3 is that really combustive, filtration, fiery center of the body that has a lot of our metabolism centered in that area. So when we palpate the middle pulse specifically, we're really tapping into that upper digestive fire, that middle jiao, that center of volcanic heat, that solar plexus. That really tells us a lot about whether or not somebody is staying active, whether or not their inner fire is burning strong, or if their energetics are kind of just like a barely smoldering lump of coal. It really gives us a lot of insight as to whether or not they have the fires of their personal engines stoked and ready and performing at max capacity. And we will palpate the middle pulse with our middle finger. So fourth finger goes to the proximal, middle finger goes to the middle, and then we go to the dorsal with our index finger, and or the distal with our index finger. So the distal pulse, that D, is going to be the pulse point that's furthest away from the body, and that's going to contain the distal pulse reflexes for horizontal zone 2 and 1. So that's everything in the upper body. That's going to be respiratory, that's going to be heart, that's going to be upper lymphatic, that's going to be cervical, thoracic, that's going to be everything in the head space, sinus, teeth, eyes, pituitary, pineal, inner ear, let's see, the brain area, can't really do much without that. And the distal pulse really talks to us about the upper body and whether or not there's going to be dysfunction in that space. As opposed to the proximal pulse, which has that deep, slower, more rhythmic sensation, the middle pulse will actually be very jumpy, and the distal pulse will be very wiry and fleeting. And traditional Chinese medicine and Ayurvedic medicine both talk about animals associated with these pulse points. And depending on who you learn with and depending on what classical text you are reading, there's going to be the proximal pulse, which feels like a swan or feels like an elephant. It's going to be graceful, it's going to be heavy, it's going to be very fluid and watery. The middle pulse is going to feel like a cricket or a frog that's jumping up towards you, very energetic, very heated, very bounding. And then we have the distal pulse, which is going to feel like a snake, or it's going to feel like a ripple across a lake, and or a butterfly, just something light and flappy, basically. And that distal pulse, because the upper body is our most mobile, it's our most free, it's our most expansive center of the body. We have a lot of our air element here. We have a lot of our thought process, our electrical stimulation in that center, as opposed to that fire in the middle and that water and earth down below. So we can see the elements kind of overlapping, and I'll talk a lot more about the elements in my next book, Advanced Foot Reading. Touched on them a little bit in Foot Reading, a reflexology primer on foot assessment, but there's definitely more to the story there. So these are the three pulses, and they represent the three body sections, as opposed to a normal reflexology map, where we would be looking at the heel representing the lower body, the proximal arch representing lower digestive, lower core, the distal arch representing upper digestive, the ball of the foot representing upper respiratory and chest, lung, shoulder, and then the toes representing the head. In the pulse, we minimize that. We take it down to three specific sections, and we pair zone 4 and 5 at the bottom, and then zone 2 and 1 at the top, with 3 continuing to be in the middle. But the map is the same. The reflexes are the same, and it's just about understanding what the pulses over time feel like and being able to interpret them just like you would palpating all of the other reflexes as well. Let me know if this is making sense, everybody. Okay, so let's talk about actual blood pressure for 2 seconds, because I have a story to share and I think it's really interesting. And I also have a couple just notes that I think are really important for traditional blood pressure. And if you, as a reflexologist, don't know much about blood pressure, I highly suggest that you learn about it, because it is, although we're not necessarily taking down blood pressure vitals like a nurse would, we are responsible for understanding what healthy blood pressure feels like. And even some of you who I've trained and who I've talked to online through our online courses or trained in person throughout my international travels, you've talked about feeling the pulse through the reflexes. And here we're talking about accessing the physical pulse directly. So it's important that we note what healthy blood pressure looks like and feels like in the tissues, as well as the energetic implications of that. So the big story that I wanted to share was I had a client come in with a health crisis. They were in the middle of a panic attack, and this client was just very, very distraught, completely white-faced, and after making sure that they didn't need to go to the hospital and that everything was okay, we got them on the table and used just a half hour of reflexology to calm them down. And their blood pressure was very, very high at the beginning of the session, as you can imagine, somebody undergoing an anxiety attack. And afterwards, the blood pressure had come back to normal color returned to the face. I encouraged them to go eat something and make sure that they, take care of themselves and reach out should they need medical attention. However, the story isn't about that person. The story is about the person who came in after. So the client after my anxiety attack client came in and was just a normal client. Everything seemed in order. They had no health issues. They were just trying out reflexology to try reflexology. And what I do, and I'll talk about this in the next couple slides, is I hold the pulse at the same time that I hold the solar plexus point at the very beginning of a session. So I'll do a bilateral solar plexus hold and then bring my 2 fingers or my 3 fingers up top. So I'm holding the actual reflex points of the solar plexus, and then my 3 fingers come on top. The index finger hitting the distal pulse, the middle finger hitting the middle pulse, and the ring finger hitting the proximal pulse. And I'll take their pulses before I begin the session. And that was how I, one of my first clues manually that the client having an anxiety attack was truly not okay, was palpating their pulse. But the second client came in, and what was terribly interesting and very scary was that their pulse rate was worse. It was higher, it was faster, it was more bounding than my client who had just come in with an anxiety attack. And post-session, we had a discussion about cardiovascular health. And it was a very eye-opening experience because they hadn't considered themselves to be quote-unquote unhealthy. And we talked about stress management. We talked about the idea of reaching out to a cardio specialist. We talked about following up with their general physician. We talked about going to the gym for cardiovascular wellness, all things that they hadn't prepared themselves to really talk about. And it was all because the body was clearly saying that that was where their issue was, but it had nothing to do with the reflexes in question. It had everything to do with me palpating the pulse and just being able to assess blood pressure and knowing what a healthy blood pressure feels like versus somebody who has cardiovascular dysfunction. And it's been really interesting with pulses in general because I've had several clients on my table where I feel arrhythmias in the pulse. And I make sure to bring it up to them post-session if they have a history of arrhythmias or if they are under cardiovascular care, to just make sure that they stay on top of that. And that's been really, that's scared a couple of clients in a good way, because especially one client specifically, she said, it's so funny that you say that because I'm actually in town to get a heart operation. And that was just fascinating, very, very confirming for them. But traditional blood pressure is 120/80. That's going to be our standard. Now, 120/80, the standard blood pressure, that's what we're looking for, systolic and diastolic, and that's a little bit too deep for us to really get into with this kind of glossing PowerPoint presentation. So I wanted to simplify that stat as about 1.5 beats per second as being a natural steady pulse. And what I find is as I'm counting, I'll count to 5. And if I'm able to notice that that the client themselves has, anywhere from 7 to 8 beats per that 5-second frame, depends on how well you can mentally multitask and palpate. But that's kind of like my go-to is I count for that 1.5 beats per second. And if they're higher than that or lower than that, then I know that that's something that I'd like to just give them feedback on post-session. So that's something that I think as reflexologists we can do that's also really helpful is using blood pressure as a modern medical tool to just be able to assess and give feedback. If a client is coming in and they're super stressed and you notice that their pulse is very bounding through the dorsal pedal pulse, then it might be within your scope to guide them through some breathing exercises or remind them to relax or ask if they would like an eye pillow or if there's anything that you can do to make them more comfortable. And that can go a really long way when clients are feeling out of touch with their body, with their physical state. And I think that that's really a really lovely asset to the practice. Okay. Now what I'd like us to do is I'd like us to go into some energetics. And this is really this is personally what I really, really want to talk about, because this is what book 2, the advanced foot reading book is going to be about, is the energetics of hot, cold, wet, dry as they relate to earth, air, fire, and water, and how we can use those energetic archetypes to enhance our foot assessment and extremity assessment in general, which then will translate to the pulse, but also in that book I'll be covering the tongue and the eye as well. So 4 energetic things that we need to look at with the pulse as represented by the 4 elements, the 4 energetic tissue states. The first is speed. How quick is the pulse? And that goes back to that 1.5 beats per second. So we're looking at speed in general. If the pulse is really slow, you might have a client who's very calm, very relaxed. Maybe they're a high-performing athlete, or maybe they've just got a great constitution. But likewise, if the pulse is very rapid, then, like I said, that's something to really keep in mind during your session and post-session for feedback. Depth is another part of the pulse, and this corresponds to the energetics of a client being cold. And what I mean by cold is not necessarily temperature cold, but cold as in withdrawn, and cold as in a lack of superficial circulation, which can be an issue. And clients who have a deep pulse or a pulse that cannot be felt on the surface will often have issues with internal stagnation. And for those of you who have an energetic background, you know that stagnation is one of the principles that tends to breed diseases like clogging, like kidney stones and clots, but also lymphatic stuckness, accumulation of fat, impingement of the joints, and things that are more unmoving. Yeah. So when we find a pulse that is deep, or we really need to use our pressure in order to press down on the pulse to feel that pulse, that's one of the energetics that we can look for as somebody who tends to be rather stagnant. But likewise, if a pulse is very superficial, if it's very easy to find, almost if it's too easy to find, then there might be an excess of peripheral circulation, which is what we find a lot in chronic inflammatory cases, because fire in general, the energetics of fire and heat, makes things rise and pushes physical structures to the surface, one of those being vessels. Yeah. So you'll notice that vessels become superficial in people who have chronic inflammation or what we'd call a lot of fire in their system or their constitution. Then we have the stability of the pulse, and I'm not necessarily talking about whether or not the pulse rate is consistent, but I'm talking about whether or not the pulse moves. And again, speaking to a little bit more advanced practitioners, especially those of you who have taken pulses with Aerovator or TCM or any other method of holistic assessment, you'll notice that sometimes when you press down on a pulse, it will slip underneath your fingers, or it will be locked in and almost rooted into the tissue. And the stability of a pulse tells us whether or not somebody's fluid accumulation is correct. Somebody who has a drier constitution, a dehydrated constitution, will have vessels that are locked in place. They are dried out. They are fixed. However, somebody with excess lymphatic fluid, who has a lot of what traditional Chinese medicine would call phlegm in the tissues, and the mucosal lining of the body is very, very strong, you'll notice that when you press on the pulse, it wiggles, or it wobbles, or it slithers, or it's slimy or slippery as a pulse. And that can tell us a lot about whether or not somebody has those deeper, watery, earthy characteristics that are somewhat out of control, versus the opposite, where they're not holding onto fluid or that dense mineral structure, and they're drying out, actually. So stability is another kind of part of assessing pulse. And you'll notice this more as you practice pulse rate with your clients, friends, and family, even yourself. And then strength is another one. So strength is something that I think is a little bit easier to understand with pulse. It's not necessarily how fast a pulse is going, but it's how strong the pulse is. A bounding pulse feels like the pulse is actually a good way to think of it is actually kind of punching you. When you put those fingers onto that pulse, you'll notice that the pulse leaps up and kind of hits or smacks your fingers. Whereas in other clients, you'll put your fingers on those pulse points and it'll be barely touching the surface. And so strength tells us a lot about the strength of an individual constitution. It tells us whether or not somebody is able to fight off infection or disease. It tells us about their energetic reserves. It tells us about whether or not they feel grounded or rooted, or if they have enough resources to go around their physical constitution or their mental emotional state. Yeah? If they feel depleted, or if they feel lacking in some way, or maybe they also feel too agitated, too strong. Okay? So those are just some energetic things that we need to keep in mind when assessing the pulse. And let's get on to practicing. And this is what I really enjoy talking to my students about, because the pulse, although it's a new thing, but it's an old thing, it's using reflexology in a new and interesting way, but it's really reaffirming some of the old mapping things that if you don't have a solid grasp on the zones or the reflexes in those sections, then you need to kind of go back to your basics and really tone up your foundation. But just like anything else in manual body work, we find that there is strength in repetition and making sure that you're taking as many pulses as possible. I know that because in Florida we have a massage law that dictates in order to practice reflexology, you need to be a massage therapist. I got my massage therapy license before I became a reflexologist. And there was a saying that said, bodies on hands. Just as long as you are a massage therapist, you will only get better if you have bodies underneath your hands, and you are putting your hands on somebody's body to actually work within the tissues, to feel the connections, to understand how to move the joints. And it's the same thing with the pulse, is we really want to make sure that we are, with every opportunity, taking the pulse of our friends, our family, ourselves, and really feeling what a quote-unquote normal pulse feels like. And especially when you're sick, especially when you're feeling really energetic, especially if you're feeling tired or if you're feeling agitated, that would be an excellent time for you to take your own pulse and see how the different rates, how the speed, how the strength, how the stability varies based on your internal and external state. Okay. So it's really just practice, practice, practice. And as you practice, you will find what a normal pulse feels like. And normal isn't really the goal. So when a client comes in and they ask me, oh, well, you said that my pulse felt a little bit light. Does that mean that I need to strengthen the pulse? Yes. I mean, you should always work to find a balance, but some people will naturally have a weaker pulse. Some people will naturally have a stronger pulse. Some people will have a deep or shallow pulse. It's definitely part of somebody's unique constitution. So normal isn't necessarily the goal, but finding out what normal is can be helpful in gauging whether or not somebody is out of balance for their constitutional state, which is a big thing that we're going to be talking about in the second book of Advanced advanced foot reading is using our assessment tools like pulse, but also through the other extremities to really consult with a client and help them understand what their normal is and working within that scope of normal and adjusting through lifestyle factors to help somebody come into a balance that is uniquely theirs. The way that I integrate pulse into a session is, like I said before, I'll start and end my session. For those of you who are following me regularly on the channel, I've posted about 10 videos of my personal reflexology routine, of which I will be posting another video and going live tomorrow because it's our training weekend. But when I start and end my sessions, I start with a bilateral thumb hold of the solar plexus reflex just below the ball of the foot in line with the third toe. And then when I have that bilateral thumb hold, I'll bring my index, middle, and fourth finger up top, palpate that dorsal pedal pulse, and as I'm holding my solar plexus point for 30 seconds, I'm also taking the pulse for 30 seconds. Now, what I encourage students to do is you're not just taking the pulse at the beginning of the session. Yeah? You can also take it in the middle and after the session as well to compare and contrast, which I find really useful, is you're not just seeing where somebody's at, but you can also feel for a progression and see, based on which of the pulses, the proximal pulse, the middle pulse, or the distal pulse, which is still out of balance, what reflexes to focus on. Yeah. And I think that that's really the crux of this work, is it's not just an assessment tool, but it's an assessment tool that inspires us to take specific action in our routine and in our post-session feedback with clients. Is, you know, at the very beginning, when you take pulse and you're like, wow, that middle pulse is really, really hyperactive. It seems like their zone 3, their liver, their gallbladder, their stomach, their spleen, pancreas, upper kidneys, adrenals, that's really a little bit too hot, a little bit too fiery. We need to calm those down. Maybe do a couple extra passes in that spot, or specifically look for any active reflex points in those areas on the plantar and the dorsal surface and see if you can't find a space that the body is asking you to deactivate some of that intensity through the nervous system. But then also checking in mid-session, seeing how the client is coming along and seeing if their pulse is changing from the beginning to the middle, and then also post at the end. What is the final verdict of the pulse? Were you able to change it? Were you able to relax things into place? Were you able to get a more even flow throughout the session? Maybe, and this is also really interesting when I work with pulses with clients. At the very beginning, there will be a pulse that might be non-existent, either a proximal pulse or a middle pulse, or maybe even an entire pulse on one side is non-existent. I can't feel it, I can't find it. And then by the end of the session, they've relaxed, they've let go, they've allowed their circulation to continue. We might have freed some impingement, some muscle twitches might have unblocked some energetics, and I can then feel the pulse evenly throughout both pulse points at the end of the session. And that's always a really kind of heartwarming part of the experience, is not just what somebody comes in for, but also how they've progressed from the beginning and the end. And that's kind of what I really enjoy, is not just finding out what's happening in the body, but doing something about it and customizing the routine and the post-session feedback to really tell us, based on what the pulse is saying, how to tweak our session. Okay, and that is pretty much it. So I'm going to flip back real quick to the home screen. And if you have any questions whatsoever, I'll stick around for just a few more minutes in order to answer questions for you. And thank you all so much for jumping on and hanging around. I really, really appreciate it. This is something that is near and dear to my heart with pulse assessment, and I'm very excited to launch into it in the new book. Especially because we won't just be covering pulse, we'll also be covering tongue and eye assessment in terms of reflexology work as well. So expanding the map and the pulse work is really the first thing that I wanted to introduce to the community and the channel and everybody who's following us at large, to really help you to understand where I'm kind of taking this work in a direction that allows us to transcend the feet and really look at reflexology as more of a philosophy of body work instead of being relegated to just being foot specialists. Yeah, because when we rely on our map and when we rely on our zoning, we truly get our teeth into the heart of the work, which is really about assessing and then giving the client feedback so that they can change their life, as opposed to us just pressing the button to fix the issue. Thank you so much, Pat. I appreciate it. Everybody who tuned on, very, very great to see you all again. I look forward to posting another video tomorrow from our certification program. And in the meantime, may the feet be with you.